The steering committee and the board of directors of St. Jude Hospital paid a strategic and significant visit to the St. Jude Hospital reconstruction project in Auger-Vieux-Fort to get an update on the progress of works since the commencement of the rehabilitation of the site on November 1st, 2022. Committee members received an update from representatives of the contractor, Construction and Industrial Equipment Limited. This project, which aims to modernize and rebuild the facility, is making great progress with key areas near completion.
We've observed, for example, that we do now have capacity at that new facility. We would have capacity for neonatal care, which is something that we do not currently offer at the George Odlum Stadium. So where you have intensive neonatal care requirements, those cases would need to be transferred to Millennium Heights Medical Complex. We would now have the ability for us to provide that service in the South. Increased capacity in terms of increased bed space, but we also have significant improvements in surgical, especially our operating room, with two operating room theaters, an additional operating room theater on maternity, and now capacity for us to be able to improve the quality of care that we and the scope of the services that we can now provide to the persons in the South.
The physiotherapy and dialysis wings, which are among the most critical components of the hospital's new infrastructure, are nearing their final stages of construction. These areas are expected to be completed in the coming months, marking a significant milestone for the project.
We can expect changes to the overall efficiency of our operations, and that's because we've started the process of process reengineering, redesigning at the George Odlum Stadium to map it against the changes here to the infrastructure at OG to ensure that we are able to improve the quality of care and the quality of service that we provide to patients, but most importantly as well that we are able to do so in a manner that meets international standards.
The completed hospital will provide state-of-the-art medical services to the community, improving patient care and access to essential healthcare services in the southern part of the island.
Works have been advancing very well on those additional buildings, including components such as the electrical works, exterior works, parking lots, the roads, etc., etc.
Construction and Industrial Equipment Limited, the contractor overseeing the reconstruction, expressed confidence in completing the project on schedule. Vinny Kulkarni is the project supervisor for CIE Limited. Kulkarni echoed the optimistic sentiments of Gajada.
We have done a lot certain improvements in terms of the modern equipments which can be facilitated to get to the end user, and we also have spaces which we have utilized for the maximum benefit of the hospital.
Caribbean Consultancy Engineering Limited is currently engaged as the consultants for Phase 1 and 2 of the project. As project manager, CCE Limited ensures all designs are accurate and meet standards set by the client, the Government of St. Lucia.
The project is split into two phases. So the first phase is coming to a completion. This is the completion of 4 buildings which the contractor needs to complete as per his contract. The second phase has been recently awarded as of October, with the contractors also moving along. That's the part where we are in a joint venture with our partner consultants, and they are progressing well on that as well. So we have some close off to do of the first part of their contract. I think the ministry would like some partial handover, but that is in talks. But that will be in its 90% currently, and the rest of the facility is about 50-something%, and the contractor is progressing well.
The St. Jude Hospital reconstruction project is expected to significantly enhance healthcare services in the southern region of St. Lucia, providing more comprehensive and modern facilities to meet the needs of the growing population.